Last presentation of the day. I would like to take a few minutes and build on the very nice foundation that Lonnie and the previous panelists have all highlighted. I will hopefully capture your imagination a little bit and tell you a story of some things that are happening now to really put this One Health workforce idea and community engagement into practice. So let's see if we can get going here. So bear with me for a moment. I'm going to ask you just a few questions and you can think to yourself whether this is happening or could be happening. We've been talking a lot about COVID, but as you're well aware, spillover happens frequently. It will happen again. We could be talking about other coronaviruses. We could be talking about Ebola. We could be talking about other arboviruses, right? We don't know exactly what the next thing will be. So I'm going to just ask you to think generally, what if you were just a phone call or an email away from talking with colleagues and experts on every continent? I think this is happening now, and we should keep building this global network of health professionals who are committed to a One Health approach. What if your students were in class regularly with students all over the world? This doesn't happen very often now. We could totally do this, right? We're connected together today all over the world, and our students would really thrive if we could find ways to do this together for them regularly to really help foster global citizenship. What if we had more competitions for innovation, really helping students to try to innovate, to share their ideas? Because as we heard just a few minutes ago, the skills that we need, the solutions that we need are going to be changing in time and in space. And we need that local context, that local adaptation of some of these key ideas to really make them effective. So the students are the future. We need to help them become leaders and systems thinkers. And they have great ideas, as I'll share in just a moment. What if team-based problem solving was the norm? I would argue this is not the norm yet, but it is very achievable and we're moving in this direction. So as we are able to work across sectors, across disciplines, foster the collaboration, I think that's going to be more and more effective at finding sustainable solutions. And what if we could find each other across those sectors and disciplines, across government, academia, and the private sector even more easily, right? We recognize some challenges that exist and have some ideas on how to overcome that. I think that's going to be really important as a best practice and a key to success for reasons that have been discussed previously. So our COVID-19 situation here, it's tragic. It is a wake-up call. It will happen again, and we need to be ready for it. I think we've seen there's some really fascinating stories of resilience and innovation coming forward. One Health is key to being able to move forward effectively together. And I think we want to really try and capture the lessons learned in order to prepare for the future. So as everyone knows already, this One Health approach is recognizing the connections between people, animals, plants, the environment, and really thinking about how do we have integrated solutions. So now we're going to talk about what's happening now, what's been happening over the past decade. Let me really extend thanks and acknowledgement to all who've been involved in this USAID Emerging Threats Program projects. Predict, as was mentioned earlier, was a sister project focused on surveillance and on-the-job training. This One Health Workforce, and now One Health Workforce Next Generation project, is a training arm focused on pre-service education and training in lots of different ways. So we have a global team that works together with the Africa One Health University Network, formerly OSHEA, and the Southeast Asia One Health University Network, SIAHUN. And so that's an ongoing project, and we're very happy to be working closely at the international, regional, and local levels. So the goal of this One Health training project is to really empower these regional One Health University networks to sustainably develop and deliver world-leading model programs for equipping professionals with the transdisciplinary skills needed to address complex global health issues. Create the space to innovate, create the space to think outside the box, as we heard, and really give them a framework that they can succeed and be adaptable into the future. So this project has a training arm, that's the external face, the workforce empowerment side. It's also a special project in that we're really trying to work on decolonizing global health. It's a living experiment on shifting leadership of this project from a US-based prime to the regional One Health University networks over the 5 years of the project. So we're doing a lot of twinning, we're doing a lot of operationalizing business practices. We have gender as a cross-cutting theme. So I want to acknowledge that really the training and the One Health approach is critical. It's been done very well, and we're coming up with even more ways to really live in a virtual world during the COVID-19 pandemic. But I also want us to think about really how do we empower local leadership to be able to strengthen capacities for the long term when some of the US-based organizations and funders might not always be in the system in the same way. So huge props to USAID for really showing leadership in this area for so many years. So I mentioned the Southeast Asia One Health University Network. So they're working across 8 countries. Almost 100 different ministries and universities are working together. It's a very impressive group that's active in the region, and they're open to having additional folks involved for special things. Afrohoon, formerly Oshea, again, is something that has been expanding. And so we're very happy to see them developing more of a presence in West Africa as well now. And just wonderful colleagues all over the world and in the region that are developing south-to-south collaborations and really bringing in faculty and students in so many different ways for different types of training. So let me just play for a moment some of the experiences that happened in the past year. This is from Uganda, from their One Health Student Club, and I'll let you see what they've been doing.
The global community is racing to slow down and eventually halt the spread of COVID-19, which has claimed over 500,000 lives and infected over 10 million people. The Students' One Health Innovation Club deemed it fit to join this global fight. SOHIC must organize a response against COVID-19 with 2 objectives. 1, to raise awareness about accurate COVID-19 information, and 2, to support the implementation of the public health interventions as guided by the Uganda National Health Task Force and the World Health Organization. Once a national state of emergency was declared in Uganda, over 21 health students in Mbarara have volunteered in Mbarara Regional Referral Hospital to support the COVID-19 task force here. To flag off the SOHIC mass response, we organized an online webinar which trained several international students from Uganda, Kenya, India, and several other countries. We equally organized a needs assessment to assess the gaps in knowledge, attitudes, perceptions about COVID-19. Following the assessment of the survey, the gaps found were used to influence and inform the community dissemination program. Here, we answered questions that the community had, raised posters about COVID-19 in both English and Runyango.
There's no point of me going home to protect myself, yet this is the kind of line I chose. It's the kind of life I'm going to lead for the rest of my years.
Global community.
So as I think you can see from the students, they're very active, they're very motivated, they're on the front lines in the communities, and that really has been a key to success. I think in this particular project, we've tried to build a global One Health community of practice as the COVID-19 pandemic unfurled, and that was very successful with many countries across these different continents tuning in. But I think the local context and the community engagement was really critical, and that's where the students come in. So we are trying to put together an Afrohoon and Siahoon One Health Workforce Academy, building on the competency approach, as Lonnie mentioned. It's not just what you know, it's what you know how to do. So this is something that will be coming live later this year, and we look forward to engaging with many of you in this forum. And I want to just highlight a lot of the innovations that have happened in the Africa and Southeast Asia region are anything from robotics to reduce exposure and contact in healthcare settings, to innovation and training approaches at the local community level. We've been using the virtual platforms and e-learning to stay connected across these different countries, but also finding ways to get the students out into the field, participate in different types of risk messaging, being able to think about how can they really do the needs assessment and help to raise awareness about COVID-19 and other issues using that One Health approach. So it is something that is an active area of work. We do look forward to being able to continue updating our methods and bringing innovations into place, and really strengthening the partnerships with the local ministries, with the local missions, has been a really important part of trying to build sustainability into this One Health Innovation Project. So the videos, the flyers that all the students and the faculty have been coming up with together, I think there's a lot of mentoring going on. And as we heard at the very beginning of today, we can't train everyone to be experts, but we can train them to be the eyes and ears to notice new things. And I think we're finding a lot of the fellows that are being supported in these different programs are really finding ways to use their experiences to come up with new solutions that are locally relevant. The One Health Champion idea, fostering leadership and giving credit for innovation, I think is going to continue to be very important. And a lot of these different annual reports and products that are coming out are finding ways to feature some of the successes, whether it's faculty who are really recognizing the value of the One Health approach, like Professor Rashid, or whether it's the students in the clubs who are showing leadership. And in Rwanda, as we've heard earlier, they've been committed to a One Health approach from the top down for a long time. And the students are seeing that open up new opportunities for surveillance and for training that they appreciate with the One Health approach. So the One Health Champions ideas, I think, is here to stay and will be important. So this project, even in the past year with the pandemic going on, has still trained over 20,000 people. So it does have reach, and hopefully we'll see scalability with some of the best practices moving out even further. And the last idea I want to leave you with today and going into tomorrow's workshop is really why I think One Health is special. It puts the technical knowledge and innovation that we have into a social context. And as we heard earlier, that's critical. We need that social context and those cross-cutting themes of economics and culture, and really thinking about how all these pieces tie together in order to have effective solutions. So this is why I think the One Health approach is here to stay. So with that, I'll stop and we can move into some question and answer in the remaining minutes we have.